the Toronto Star. I'm Raju Mudler, and this matters. Mushrooms, MDMA, and LSD are just some of the drugs that have reputations for their recreational use, but now are slowly being embraced by researchers and physicians for therapeutic purposes. In Canada, 4 terminally ill cancer patients have been approved to use psilocybin, the active ingredient in mushrooms, as part of their end-of-life treatment. In the US, in this past election, voters in Washington, D.C. and Oregon respectively chose to decriminalize and potentially legalize psilocybin for healthcare uses. To many experts, the darkness of the criminalization of these drugs is lifting, and we may be at the dawn of a new era of using psychedelics for medicinal reasons. Omar Mosleh is a Star Reporter based in Edmonton, and he recently did a deep dive into this topic. He joins us to talk about what he's learned about these mind-altering substances and how they may be harnessed for therapeutic uses. Omar, thank you so much for joining us today.
Thanks for having me.
So I want to get into what is current about this, and I hope this is a bit of a trippy discussion, but I think we should start with a little bit of history. The truth is that many of the party drugs that we know people use for fun were created with therapeutic uses in mind, right?
That's correct. Basically, it was in the 50s and 60s when they started really looking into the use of, at the time, primarily LSD and psilocybin, the active ingredient in magic mushrooms, potentially for treating a whole host of mental health conditions. But the main one at that time they were looking at was schizophrenia, because they realized, well, these drugs make people hallucinate. Schizophrenia also makes people hallucinate. Maybe there's more we can learn about this disease, which at that time they didn't know much about at all, and how it causes psychedelics to lead to hallucinations. So that was one of the main areas.
Research in this topic basically hasn't been happening for many, many years, right?
That's correct. There was a lot of it happening in the 60s and 70s. There were a few factors that led to these drugs being criminalized and demonized. Basically, like the hippies and the counterculture, and Timothy Leary telling everyone to sort of try LSD and expand their consciousness. That wasn't received well by the Richard Nixon administration, and the war on drugs was declared. And since then, it's been really hard, especially in North America, to do any kind of research into psychedelics for therapy. And that's really been changing, I would say, since the mid-2000s, and then really ramping up since about 2014, 15. It's mainly just because health boards are more open to approving this kind of research happening at universities, and there's been a ton happening ever since.
Okay, so your piece talks about how some people are using these things in new and therapeutic ways. I think we should start off with, who is Thomas Herkle?
Thomas Herkle. So Thomas is he's an IT technician from Saskatoon. He's kind of this, kind, gentle man, very straight-laced, never tried drugs in his life, isn't really a drinker. But then he got terminal cancer, and he realized that, his days were numbered. And he stumbled upon medicinal cannabis to deal with side effects of chemotherapy. And he found a lot of success with that, saying it was a lot better than the prescription drugs he was being prescribed otherwise. So that kind of opened his mind to the potential of what were once illicit drugs for relief. And after medicinal cannabis, he was researching a mushroom, which is kind of ironic, called lion's mane mushroom, which is not a psychedelic mushroom. It's just kind of like an herbal supplement that you'd get, which he learned was helpful for chemotherapy side effects. It was a good story narrative because this guy just researches everything. And, as an IT guy, he loves to read about things on the internet. So he found about this company called Theracil. And they were lobbying the federal government and have been doing so for some time now, basically to allow for psilocybin, magic mushrooms, to be used for end-of-life anxiety, because they found a lot of success, I guess, in research papers and literature with that. And so he got in touch with the organization, and he became one of 4 people approved by the federal government to grow their own mushrooms and use them legally. It's an interesting story because he's truly a trailblazer. Like, this is historic. But he doesn't see himself that way. He admittedly says, he's like, I'm just a selfish guy who wants to spend time with his family, which I don't think is giving himself enough credit. But it made for quite a compelling story, because he's just not the type of guy you would expect to be growing mushrooms and eating them. But he has said it changed his life.
Well, and this is just it. He had terminal cancer, but the other thing about it is that he had crippling anxiety because of this death sentence. And the other aspect that I found really interesting is that, he's worried for his kids. His kids, I believe, are on the autism spectrum, so they require a little bit of help. So can you talk a little bit about what the therapy was like for him and then what he says the effects are?
Sure. And that's a really important part of psychedelic assisted therapy. It's not just a session where you show up, eat some drugs, and you're healed.
That's Saturday night, right, Omar? I'm kidding. Sorry.
For some people, I suppose. There was a very strong emphasis by one of the guys I interviewed where I remember him saying, if a bunch of teenagers eat, 500 micrograms of LSD and then go to a pizza parlor and then flop their faces into the pizza, it's not going to be a very healing experience. So everyone I spoke to really, really, really repeatedly emphasized that you can't just do these drugs and expect your life to change. It's really actually about the counseling beforehand to get to some of the root issues of your anxiety, and then going into the psychedelic assisted session with the intention of addressing those root issues, and then more counseling after the session and what they call integration. So basically taking the things you discover about yourself during this session and integrating it into your daily life. And without all that stuff, they say it's not effective and it can actually be harmful for people. So yeah, he basically was doing counseling, trying to understand the root of his anxiety, which I think a lot of people can understand. If you're dying, it's pretty scary, but basically trying to come to terms with that and the whole concept of death. And I wasn't actually able to get very deep into the experience itself, but he had described to me going to these different places in his mind while listening to music and being a feeling of familiarity and really being like, I've been here before, which I found was really powerful. And he specifically compared it to the feeling of when he's doing surgery and going under anesthetic and that moment before he goes unconscious. Yeah, so he compared it to sort of being awake and asleep. And that brought him a lot of comfort. And he said, I realized this is not all there is. And I've been here before. And then that was tremendously powerful to me.
Now, this is the thing. He says it's also had lasting effects afterward, correct?
Correct, yeah. So he actually told me he did a test. There's typically a test a psychiatrist will ask you. I think you score out of 50, where they ask you things like, are you eating properly? Are you having trouble sleeping? What other kind of symptoms are you showing? And he scored 36, which is considered severe anxiety. And that was the day before, or I think a couple days before his treatment. And the day of the treatment, after, when he basically came down from the effects of the drugs, he scored 0. And then since then, it had been hovering around 5 or 6. And this is months later. So yeah, he said he's had long-lasting effects. And the way he describes it is that basically there was just this constant chatter in the back of his head. No matter what he would do, all he could think about was the fact that he was going to die. And he said it's basically just brought him more sort of mindfulness and, being able to live in the moment and not have this constant negative chatter in his head. And he said it's just changed his life in so many ways and that he can just feel like he's there with his family. I think a lot of people who have anxiety or OCD or depression can sort of understand what he means by that sort of negative chatter.
And while we're talking about shrooms, there are other drugs being looked at here too. Can you talk a little bit about those?
Yeah. So psilocybin is the main one. Some people are saying it's the safest in terms of just the dose and everything, but some people dispute that. One of the researchers I spoke to, Mark Hayden, he's very intrigued about the potential of LSD for treating all sorts of things. They basically work on the same brain receptors. The main thing about LSD is that it lasts a lot longer and is quite a bit more powerful in that it's measured in micrograms rather than grams. So yeah, LSD is being used for, right now it's mostly just research in like clinical trials. They're looking at it for adult ADHD, impulse control, OCD, and also anxiety. So there's some crossover with psilocybin there, and they kind of affect the brain in the same way. The other big one is MDMA, which is primarily being used for PTSD. That one is, I've been told, is the legalization to the point where you're going to be able to go to a doctor and get a prescription and use it under the supervision of a therapist is imminent. I've been told that's going to happen by 2022. And MDMA is, they say, useful for treating PTSD because it basically allows people to access their emotions when they've become numb to them after a really traumatic experience. And there's a ton of research happening around MDMA and PTSD globally. So that's definitely an interesting space to keep an eye on. And then one other one that hasn't got quite as much attention is ketamine. And ketamine is different than the sort of classic psychedelics like psilocybin or LSD or mescaline in that it's actually a dissociative. So when people do ketamine, they're basically detached from their body and have an out-of-body experience. And with large doses that are usually administered via IV. People basically lie in a bed and are like gone for like an hour or two in what is typically referred to as a K-hole. And there's been, the research behind it is still uncertain because, a lot of this stuff, it's just all opening up now. But there has been quite a few examples of people who've experienced lifelong debilitating depression that basically just said this ketamine experience and this out-of-body experience totally reset their brain. And there are people who are saying they've got over lifetime of depression after 1 or 2 sessions with ketamine. So there's actually a clinic in Toronto that's doing it now. I think they're closed because of COVID. That's actually, there's an analog of ketamine. I believe it's S-ketamine, which is actually legal for those purposes. So that's actually already like a thing now.
We'll be right back. What are therapists asking for in terms of this? What's next? I mean, I'm surprised to hear that MDMA could be approved for therapeutic purposes by 2022.
I think we're going to be seeing a different world in about 5 years. And like, honestly, it already feels like a different world with cannabis legalization compared to, even 2-3 years ago. So the therapists want to use psilocybin themselves. One of the guys I spoke with compared it to a sex therapist who's never had sex. Probably not someone you want to trust. So they're basically just being able to get an exemption as well. And the main idea behind that is because right now there's maybe, a handful of therapists who are actually have the expertise to lead people through this and go through the counseling with them before the session and after. So they would be able to just expand it to a whole lot more people. So you could get therapists to actually get an understanding and expertise with this drug so that they can do the therapy as well.
You mentioned in your story a number of companies that are interested and involved in this. Let's talk about them a little bit and some of their approaches. I think one of the ones that you mentioned that sounded really interesting to me is that they're trying to work with psilocybin and make it, say, a 1-hour dose as opposed to 8. What kind of stuff like that is out there?
Yeah, there's a ton. It's really quite interesting. Honestly, I could only really scratch the surfaces of all the companies that are doing research into this, but I picked some of the ones that are some of the most interesting or really seeing a lot of momentum in getting approvals. The one you had mentioned is Bright Minds Biosciences, or I think Bright Minds Biosciences. They're based in Toronto, and they're basically trying to create analogs, so different versions, tailored versions of various psychedelic drugs to make them more useful for psychotherapy. So the one you had mentioned was they're trying to make a version of psilocybin that lasts for just an hour. And the idea behind that is that it'll just be more cheaper and more accessible. If you're looking at 12 hours of time in a clinic, like LSD can last from 8 to 12 hours. 12 hours, under the supervision of a clinician in a clinical setting, that's going to cost thousands of dollars. So the idea is that you could sort of just pop in and have a businessman's trip, some would call it. Yeah, I don't know how much of that actually is happening with that, but I thought it was worth mentioning. And I reached out to that company particularly because they're actually already starting the process of getting US FDA approval and seemed quite optimistic about it. So like there's a lot of things happening, and they're getting interest from big pharma companies. And that to me was illustrative of how people are actually taking this stuff seriously now. It's all opening up. Once you start seeing big pharma coming in, there's money involved. So things are going to start happening.
Okay, now we should be very, very clear. This is not for everyone. And right now, the approvals are coming for very, very specific sets of uses, like end of life or palliative care, right?
Yeah. Everyone I spoke to was really tried their best to emphasize that point, that psychedelics can be destabilizing for people, especially anyone who has any kind of history of psychosis or schizophrenia. Those can also be triggered by cannabis. So if you've had a bad experience with cannabis, you definitely should never try psychedelics. It's a very unique treatment some would say it's for people who have had resistance to traditional treatments, like, maybe try this if nothing else works. I'm certainly not an expert in the medical community or in anything medical. So I would just say consult your doctor and see if it could be something for you. I don't know how open-minded your general family physician is to this kind of thing, but just do your research and if you think it might be the thing for you, ask the people who are experts and see if there's an avenue into it.
You kind of mentioned it before, but how's the legalization of cannabis changed things for these people who are advocating for psychedelics and their uses?
I think it's just made the boards who do these approvals more open-minded. There's been a lot of talk about the medical uses of cannabis, just in terms of, for people who have cancer or for people who have trouble sleeping or trouble eating. And I think just like the general widespread acknowledgement of that in society has led to these boards being more open-minded. Like there was a point where, in the 60s and 70s where cannabis was, portrayed in commercials as this horrible, horrible drug that would ruin your life and had absolutely no medical use. And that has just shifted fundamentally, where I think everyone acknowledges that even if cannabis is not for you, there are some people it can help. And that's why, you can get it as a medical prescription. So I think just that acknowledgement of, we do need to look at the potential of everything to help people has just led to more open-mindedness in this whole area.
You obviously talked with a lot of people about therapeutic uses, but did anyone at these companies talk about legalization for recreational use and where that might be on the timeline or plan?
The word recreation was not used in that context. In fact, it was used to say these are not recreational drugs. But there was one whole area of the article that I actually had to cut, both for lengths of brevity and just really narrowing in on the story we wanted to tell, which was mental health. There was one area, like I spoke with this neuroscientist, John Vervaeke, who's written about what he calls the meaning crisis in the 21st century. And that was absolutely fascinating because he talked about how a lot of people are just feeling lost. And he talked about rates of rising suicide, rates of rising addiction, disaffiliation from politics, disaffiliation from religion, and being glued to our phones. And just like this whole paradigm shift that he believes society needs to get more in touch with ourselves and basically rediscover our purpose for living. He believes psychedelic drugs can play a big role in that. I did quote him to some extent in the article where he says they can break the frame that cages you to conditions such as depression, basically just, reset your brain. But he talked a lot about how that can be useful for people, not necessarily who have a mental health condition, but just feel like they've lost the reason to live, or are bored with their lives or feel apathetic about things. And I thought that was really fascinating, but it didn't quite fit into the mental health piece, even though it's related. Something like suicide is obviously generally stemmed by someone who has mental health issues. But yeah, he saw it as sort of a broader societal antidote to some of the issues we're facing in this day and age because of technology, because of personal relationships. And I found that area really interesting, but it's a bit of a harder sell to say, everyone who has problems, just go try psychedelic drugs and make your life better, right?
That is a hard sell.
Yeah, it's an area you have to be a bit cautious about. He was really fascinating, and he talked about it in this metaphorical term of the human zombie, which goes around and consumes endlessly, but never finds satisfaction. He uses the zombie as this way to describe sort of existential despair in the universe. It got really philosophical and deep, and I love that kind of stuff. And it was a lot to convey to a reader in, 200 or 300 words.
Well, Omar, you did mention something else to me that I found interesting that didn't make it in. Some of these drugs have had success with cluster headaches?
Yeah, so cluster headaches, that's just this really fascinating thing because everyone I mention it to is like, what's a cluster headache? Nobody actually really knows what it is because it's not a very common condition. It's something I've known about for a while. I ran into a documentary years and years ago about people who were using psilocybin to treat cluster headaches and were finding it to be the only thing that worked. And it's fascinating because nobody really knows what cluster headaches are. So a cluster headache is, I guess you could compare it to a migraine, but it's even worse. It's been described as comparable to giving birth or losing a digit, like a finger. They're also called suicide headaches. And I'm not over-exaggerating this. If you Google them, you'll read harrowing stories of people who say this condition has completely ruined their lives. And the cause is unknown. Nobody knows what causes cluster headaches. There's some speculation, but nobody really understands them. And they've only really recently been acknowledged as a real medical condition in the last 10 years. I spoke with a lot of people who told me about how they would go to doctors and just get misdiagnosed. A lot of doctors just dismissed it as a psychological thing or as migraines. So I found this website called Cluster Busters. And it's a website consisting of people who are professionals that learned that psychedelic drugs have this weird, mysterious cure for cluster headaches that nobody really understands. And so they started posting about their experiences on Cluster Busters with illegal drugs because they didn't want to speak about it publicly out of fear of losing their jobs. So I went on this website, Cluster Busters, I joined the forum and I started talking to people, and I spoke with numerous people who said, my cluster headaches, which have ruined my life for the last 10, 15, 20 years, have been completely stopped with the use of psilocybin. Nobody understands it, but for some reason, when these people do a large dose of psilocybin or LSD, the cluster headaches either are drastically reduced in intensity and frequency, or they just stop altogether. And like, there's hundreds of people who have had this experience, to the extent that this entire forum is dedicated to people who want to use psychedelic drugs to treat cluster headaches. And nobody understands it. Like, it's just this medical mystery, which to me was fascinating. And it shows how the sphere of research into psychedelic drugs is really in the infant stages, and nobody understands a lot of it. So I think that's going to change. So to me, it was just a really good example of how, because of lack of research and prohibition, there's so many question marks when it comes to psychedelic drugs and the keys they have to unlock potentially.
Well, Omar, this has been fantastic for us, a fascinating discussion. Is there anything I didn't ask that you think that our listeners should know?
It's been a really valuable discussion. I guess just the most important thing is, if you're thinking about trying psychedelic drugs, do your research, consult a medical professional, and also be open-minded.
That's a great way to end. Omar, thank you so much for your time today.
Thanks, Raju. Thanks for having me.
Omar Mosleh is a Star Reporter based in Edmonton. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudhar, Adrian Chung, and Saba Etizaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.